last week we talked about STI, sexually transmitted infection. So today our topic will be linked to STIs, right? Now ladies, that lower abdominal pain that you are having, it might not just be cramps, right? It could be something more serious, something very, very severe, like PID, pelvic inflammatory disease. Pelvic inflammatory disease. Welcome to Talk Health with Nurse P, where we give you health tips in simple and practical ways. Now, let's get straight to the point, to the topic of today, PID. Now, what is PID? PID is an infection of a woman's reproductive organ. Please get a pen and a jotter and write down. PID is an infection of a woman's reproductive organ. Now, these reproductive organs could involve the womb, which is the uterus, the fallopian tubes, and the ovaries, right? The womb, which is the uterus, the fallopian tube, and the ovaries. Now, here is what is the scary part of pelvic inflammatory disease, also known as PID, is that it is often linked to untreated sexually transmitted infection. It is often linked to untreated sexually transmitted infection. That is, if you have a sexually transmitted infection like gonorrhea, like chlamydia, and you have not treated it, it can link you or lead you to pelvic inflammatory disease, also known as PID, right? Gonorrhea, chlamydia, in fact, sexually transmitted infection can expose the woman's body to pelvic inflammatory disease, right? But listen, PID does not always shout, right? That's the problem. That's where the problem lies, is that it does not actually shout, it does not show its symptoms. It mostly whispers, like gives you silent signs that something is not right? Now, number one sign you always notice, or symptoms you always notice, is lower abdominal pain. Lower abdominal pain, right? Another thing is unusual vaginal discharge. Now, the reason why we say it does not use to shout is because these symptoms can also be linked to other infections, right? It could still be linked to an STI, right? It could be linked to hormonal imbalance. These signs, right? Now, unusual vaginal discharge, pain during sex, and irregular menstrual bleeding. These are the subtle signs it could give you. Sometimes it can also come with fever or general body weakness, right? Now, sometimes there are no signs at all. So you can be very fine and have PID. You can be going about your normal day and be a carrier of pelvic inflammatory disease, right? And then if PID is left untreated, what are the things that could occur as a result of untreated PID? Remember, PID is coming from an untreated situation already. Now, if you now leave it untreated, what are the things that are likely going to happen? Number one thing that can happen to a woman who has pelvic inflammatory disease and is not treating it is infertility. Why? Because these infections are lodged in the fallopian tube where fertilization is supposed to occur. Sometimes they can be found in the ovaries and not even allowing the eggs to be produced for fertilization, or they can be found in the uterus, right? And the uterus is where the child, after being born, after being fertilized, is being implanted in the uterus. Now, when these infections are present in any of this part of the body, part of the reproductive organ, they do not allow fertilization, they do not allow reproduction, right? So the woman may end up being infertile, right? Now, another thing is chronic pelvic pain. right? Now, if a PID is left untreated, that person is going to have a chronic pelvic pain, right? Another thing is ectopic pregnancy. I know many persons have heard of this before. Ectopic pregnancy, and ectopic pregnancy is a life-threatening condition, right? Because of how it presents itself, where the fertilization actually occurs, right? But instead of the embryo being implanted in the uterus, it is being implanted outside the uterus, right? Now, this ectopic pregnancy is a life-threatening condition, right? Yes. So now another thing is the prevention. What do you do to prevent PID? Now, let's start with the fact that PID is preventable, right? Because PID comes as a result of untreated sexual infection. It means it is treatable, because if you have protected yourself against sexually transmitted infection, you will not be having PID. Yes. Now, like I would always say, the first thing to do is abstinence, right? Abstinence, practice safe sex. Now, safe sex keeps you away from STIs, and when you're away from STIs, you're automatically away from pelvic inflammatory disease. Number 2 is go for regular STI screening. Go for regular STI screening. Yes. Number 3 is avoid self-medication. Now, the reason why most times STIs remain untreated is because people indulge in self-medication. Now, you notice that you're having a symptoms that is presenting itself as STIs does not automatically mean you have an STI. The best thing to do is to go for a screening, right? A test. And then you have to confirm first that this is STIs. And then when you confirm that it is STIs, your doctor will actually prescribe to you a medication to actually treat that STIs, right? Or probably manage the symptoms, right? Now, if you begin to self-medicate, you leave that STIs untreated, because you will probably not know what spectrum of drugs will actually work for this spectrum of infection. Is it a bacterial infection? Is it a fungal infection? Is it a pathogen, right? Whatever, right? Now, you are not, it is not your place to actually know what organism is causing this infection, and so you do not know if it is treated. Now, that is where self-medication now leads you to PID, because you've taken drugs, but you've left the sexually transmitted infection untreated, and this untreated sexually transmitted infection now eventually develops into a pelvic inflammatory disease when they begin to infect your female reproductive organs, right? Now, the next thing is to seek medical help early if you notice any unusual symptoms. I would always say the first point of contact when you experience unusual symptoms in your body is not AI. Sister Nkechi, Brother Marcus, please come closer. When you're experiencing any symptoms, hold your ear. Don't run to ChatGPT. It's not the time to go to AI and begin to Google your symptoms, because these AI tools are actually giving you answers based on what other people wrote, what is already written down, not what is happening to you. So the best thing to do is to visit a health facility and get yourself tested, right? Now, please, I'm advising you, don't ignore your body. It sends signals, right? Your body is sending you signals, so please do not ignore it. The best thing to do is to listen to your body and seek help when you need it, right? Now, your reproductive health matters. To every woman out there, your reproductive health matters. Do not gamble with it. Do not joke around with it. Your reproductive health truly matters. And even to our men, Your reproductive health matters too. So treat yourself, get yourself screened. If you have an STI, visit the hospital, get yourself tested, get a medication and treat yourself, because your reproductive health actually matters. And don't wait until it's too late to act. Don't wait until it is too late to act. Don't wait until when the infection has found a space in your reproductive organ. That is when you now begin to treat it, right? Don't wait until you begin to experience infertility before you begin to treat that infection. It may be too late, right? Now, if something feels off, please get yourself checked today. Right? Now, if you found this video helpful, follow our YouTube channel, Talk Health with Nurse P, where we give you simple health tips for you to practice, right? And subscribe to our YouTube channel, like our post.